Atrial fibrillation, or AFib, may sound complex initially. AFib is when the heart's rhythm is irregular, causing fluttering or racing sensations. Sometimes there are no symptoms. AFib is the most common treated heart rhythm disorder. AFib can cause blood to pool in the heart, which can raise the risk of blood clots. Medicare can help with prevention, diagnosis, treatment, rehabilitation, and medications. Before we get into atrial fibrillation coverage, it helps to look at what Medicare covers overall. Part A covers medically necessary inpatient hospital stays and skilled nursing facility care. It also covers hospice and some home health services. Part B includes doctor visits, preventive services, durable medical equipment, and outpatient care. Part D generally covers prescription drugs you get from a pharmacy. Medicare A, B, and D can include coinsurance, copays, and deductibles. In this video, we'll walk through AFib prevention, diagnosis, treatment, rehabilitation, and medications. Doctors usually define AFib by two classifications, paroxysmal and persistent. These classifications do not represent different types of AFib. These classifications help doctors evaluate where patients are in the disease process. A fib that comes and goes is called paroxysmal AFib and typically lasts less than 7 days and may not require treatment. A fib that lasts longer than 7 days is called persistent AFib and usually requires treatment. A fib risk can rise due to many factors, including high blood pressure, diabetes, smoking, and sleep apnea. Medicare Part B covers many preventive services, including a yearly wellness visit that may support a prevention plan. Medicare also covers a cardiovascular behavioral therapy visit, which may include diet and exercise counseling. Medicare Part B covers heart-related diagnostic tests, doctor visits, and outpatient care, subject to a deductible and 20% coinsurance. AFib is diagnosed by recording the heart rhythm. A common test is an electrocardiogram. Longer-term monitoring may include a Holter monitor, patch monitor, or an implanted device. An echocardiogram may check heart structure and function. In addition to ordering blood tests, a doctor could review the patient's medicines, sleep habits, diet, and lifestyle. AFib treatment usually has several goals. Doctors look at treating heart rate and rhythm, stroke prevention, and related health risks. Medicare Part B may cover medically necessary outpatient treatment. Cardioversion is a procedure that tries to reset the heart's rhythm. Some people may need catheter ablation procedure that targets abnormal electrical signals. A pacemaker may help patients with specific rhythm problems, but it is not typically a cure for AFib. Doctors may also prescribe specific medications for treatment. Medicare coverage for inpatient stays begins after you meet the Part A deductible. Follow-up care may involve symptom monitoring, heart rhythm tracking, and the effects of medications. Part A applies to skilled nursing facilities when certain criteria are met. Skilled nursing care typically requires a 3-day inpatient hospital stay first. Medicare covers cardiac rehab for certain heart conditions. Examples include a recent heart attack or bypass surgery. Ask your doctor if you meet the rules and confirm coverage with your plan. Drugs often play a role in managing AFib. Some lower the risk of stroke, and some control heart rate or rhythm. Blood thinners are one option in treating AFib. Prescription drug coverage varies by plan rules, tiers, formulary, and pharmacy network. A formulary is a drug list covered by your Part D plan. A drug may require prior authorization, step therapy, and quantity limits. Part B often covers drugs given in medical settings. In most cases, this involves drugs given via injection or infusion and vaccines for prevention. Original Medicare and Medicare Advantage work differently. With Medicare Advantage, additional rules come into play. All plans must include Medicare services. However, the guidelines can change. Network use, referrals, and prior authorization may affect access. Medicare Advantage plan rules can also affect costs and timing. AFib is common and manageable, but it should always be taken seriously. One of the primary concerns is stroke prevention. Medicare may help cover many services, including testing, treatment, hospital care, and medications. The key is to understand the symptoms and the diagnosis. Know the reason for each treatment. Then verify coverage. Clear information, the right care team, and thoughtful use of Medicare can make atrial fibrillation feel far less overwhelming.